we know us now a long time, and it's very difficult for a lot of patients if they come to us, because we feel the fear of the patient before they come. But how did you feel before you came? Because Charles said me you were very anxious, yeah. And
I was really anxious. Like, I think I said to you, once I saw that there was actually a building at the address, it was like, oh, okay, it's all good now.
Yeah.
Because you're doing stuff over the internet, you don't know, right?
Yeah.
You just don't know. But when we had our Zoom meetings, you made me feel very at ease. Like, I wasn't nervous about the surgery. I think, you're in so much pain that it's like, let's just do this kind of thing. So, yeah, but you just don't know what to expect. This time was much easier because I knew what to expect.
You knew everything.
Yeah. So,
but what are your biggest doubts before you came?
I think because I'm very frugal with money. I thought, oh my God, I'm spending so much money on myself.
Yeah.
What if it doesn't work? Or what if nobody's at this address? Just all this, just unsure. But that's a lot of my personality. But otherwise, I mean, once I got in and I saw the facility, it was like, okay, I feel good.
And you have the feeling that the Zoom conference or the video conference we did it help? If it's better to see someone or than to write only emails?
Absolutely.
Yeah.
Yes.
You had a long story, because I heard you had years pain in the back.
Yeah.
And what kind of therapy and treatments you did before you came to us, or before you decide to make a surgery?
I've been seeing a chiropractor since I was 10 years old, I'm sure. Chiropractor, massage, dry needling. I don't know if you know what that is. Dry needling, that really helped a lot. But the most recent was radio frequency ablation. And that worked wonders.
How long did it help?
When I first started doing it, probably 10 or 11 months it would last.
That's good, yeah.
But then, when I started
distance
looking,
getting closer and closer, and the effect like, lower and lower.
Yeah, like 3 months and not so great, and so they were doing a lot of spots, like so.
And who doctor said at first that you need a surgery, and which kind of surgery he advised you?
You.
I was the first one.
I saw a surgeon in Calgary, and he said, "There's nothing we can do to help you."
So they had no idea for surgery, even not a fusion or something like this.
Oh, he said fusion. He said, but you wouldn't want that. It wouldn't be good. He said, maybe we could do 2 discs, but that's not enough. You need probably 4.
Oh.
And we won't do 4. And he just basically.
And how did you find the possibility of an ADR?
My daughter actually said, she said, Mama, I'm sure that they replace discs. She's a paramedic.
Oh.
And I said, oh, well, then I'm going to, start looking into it. And yeah.
So your daughter is your angel, yeah?
Oh, yeah, because she'd heard lots of stuff. So I just started.
And you found it in the internet? And
yeah, lots of information on the internet. Yeah. And I found a support group of people that had a lot of back pain and were considering ADR. And all these doctors' names came up, and I started making a little list of all the names, and good stories and bad stories.
And how many did you contact?
I contacted 3.
3, yeah.
Yeah.
Was it difficult for you if you had so many different meanings of doctors? Or I think normally they say, "Oh, we can help you with a TDR or ADR." Yeah.
They didn't give me a lot of information. They just said 2 and for this amount,
Okay.
So like a cost estimate, but not a lot of information.
But you had video conferences with all of them, yeah?
No, just email.
Just email.
Just email with they have North American
agencies,
people.
Yeah, okay.
Yeah. So,
okay, so
yeah.
And was it difficult for you if you hear 4 levels and 2 levels to decide, or did you get the information you need to decide, or was it?
I did because I knew from looking at my X-rays and everything, and I'd read my X-ray report and I'd have to look up the meaning of every second word, but I did it, and I knew that there was no space between. There's no space between like 3 vertebrae. And
on congresses, when we talk together, the discussion is always big. You have 10 doctors, 10 meetings.
Yes.
So it's even for us very difficult if the patient's asking us and we try to give an answer and we know in the head, okay, you can say this or this. I have a conference today with a patient and he said, yeah, I have a second opinion now. And he said 2 prostheses and you said only 1. And I said, yes, of course, nobody knows it really, because even if you have the statistic, you don't know where the individual patient is standing in the statistics. So it's very difficult for us too. But the problem is always, do you want to make an overtreatment?
Right.
So you make 4 prostheses, but it's a bigger surgery, more risk.
yes.
Or you say, I go step by step. At the beginning, we go step by step. We had good success with this. Then we getting more courage because we had more experience. We do 3, 4 levels in one surgery.
Yeah.
It works, but we saw the disadvantages for a big surgery.
Yes.
And today we can do both, and so we don't know which is better for the patient, really.
And I guess it would all depend on the patient's health too, going in to it, and how much they're willing to work. But
The good thing is we have more experience with the prosthesis than the patient because he never had it.
Yes.
So you have no statistics, so from experience.
And the Italian doctor, he gave me a list of 10 different prostheses, and I had to pick, and I'm going, I don't know that. I don't know that. You
10
pick.
prostheses, kind of prostheses.
10 different kinds, and it's like, oh.
Yeah.
Charles said, well, you should look into it. I'm going, no, I don't want to get into it that much. So.
But if you're buying shoes, it's easier for you if you 10 different shoes to say this one is the best for me.
Which one feels good?
Okay. How was the discussion in the family? So how did they react, your husband, your daughter, and so?
It was hard. Well, I brought it up to Charles, and I said, they can do this. They can replace these discs, and we just started talking about it. And for me, the real thing was the money, and not that it's he has to say it's okay to spend that kind of money. But when he told me, he said, so it'll probably be about this much, and I said, I think maybe. Him saying, well, we can manage that, know, and that told me that he was on board, and then I felt better about moving ahead, and that's just our relationship kind of thing. But no, they were all kind of worried because they didn't get to Zoom meet with you when Charles was in on the Zoom meeting. He felt much better too. He said, oh, you're right, just talking to that guy you feel better. But the girls were still a little worried, but they trusted my judgment. And said,
it's interesting for me now to know how it's in the background of the patient, because I know the background here when we discuss, but it's for me always the big question mark, how courage must the patient be to say, I fly 8-9 hours to another country and makes a surgery there. The pity is in the moment that normally the most doctors say, if they see a bad spine, we don't make anything, or they make a fusion. So the TDR is not so common, and not the big in the meaning of the doctors and of the patients. So it's always difficult for us to see how long the way is that they find us in the internet. You told me that you find us very, very bad.
It was. I had to do my research. So,
so it was your study.
Yeah.
Was it necessary for you that Charles come with you? Because now you're alone here, and the last time Charles was with you?
Yes, it was necessary.
Yeah.
Especially since we had the revision a week later. I mean, he would have been flying out last minute kind of thing, because I would have been freaking out. But yes, it was important that he was here.
Yeah.
For both of us.
Both of you.
Yeah.
Okay.
Yeah, and then 10 days turned into 4 weeks. And
so you would advise other patients to come as couple or with partner?
I think it depends on your personality. I mean, this time I was completely fine coming on my own. Completely fine. It was just like, oh, I know what to expect.
Now it's like home, yeah?
Yeah.
You stayed more weeks here in this year than did home. So.
Yeah, I got the same room, same bed. Yeah, it was just not a problem this time.
Yeah.
And Charles is just really really busy right now at work, and it would have just added so much stress to his life.
But he could work here also, in this time,
I know, but it just throws him off a little bit. So
we met us always in the midnight, and then we talked together when you were sleeping. How exciting do you were in front of the surgery, the first day before we did the surgery?
Excited? Ugh. No, wrong word. I wasn't excited.
No,
no, I was pretty nervous for the surgery because that's the only one I've ever.
Okay.
I hadn't had any surgery. Well, when I was my tonsils.
Yeah.
But after the first one, it was like, oh, okay, all right.
Yeah.
Yeah. And then when there was no pain, it was like, this is just amazing. It was amazing, and it was everything. I kind of kept my hopes low. I tend to do that, keep the bar low, and then you're surprised and happy with how it turned out. So, yeah.
I can remember when you had the lumbar prosthesis and we talked about the cervical spine, and you thought, oh, second surgery, and we are discussing, do we now or later? And
yes.
So, what was the main point that you said, I'm here, I want to have the cervical spine too?
Well, I think that the thing was that you'd go home. I'd go home and I would be worried about doing anything because you said the risk was there that things could happen, and neither Charles or I wanted to even wait 4 months like that. So we just thought.
And the crazy thing was the findings in the cervical spine were more severe than in the lumbar spine, but you had not so much pain there.
No pain.
No pain.
No pain.
It was only very narrow, the spinal canal.
Yes.
And we were afraid that something can happen,
Yes.
So.
And my neck kind of curved the wrong way.
Yeah.
Right? But I knew I had issues with my neck from a chiropractor 25 years ago.
Yeah.
And I basically said, my neck doesn't hurt, my back hurts. Let's talk about my back. So.
Yeah. Because normally we do it upside down. We start always with the neck surgery because here this area is more dangerous for the patient than the back. But how long did you know that you had neck problems before?
Probably 20 years.
20 years.
Yeah. But because there's no pain, it's like like they say about any surgery, you have to think about it and you have to be in a lot of pain, and and it's like,
it's really funny. Sometimes the patient has no pain, then it's not so severe,
yes.
But they have paralysis and all the other things, but they feel more the pain a severe problem than the other symptoms.
Well, because it it affects your whole life, right? If you have pain, you can't do everything. It hurts to do everything.
But the main point was perhaps that you have shown me the video. What's the name of the sport you do?
Wake surfing.
Wake surfing, yeah.
But it's wake surfing, not wakeboarding.
Wakeboarding, okay.
It's wake surfing, so I'm not being pulled by a boat.
Yeah.
You're just following behind it.
Are you falling only, yeah?
Yeah, and it's slow.
It's slow,
like 10 miles an hour.
But it looks dangerous.
No, but it's so slow. It's 10
When I saw the video, I said, oh my God, she needs a surgery on the neck.
No.
So the next season is starting with wakeboarding?
June,
okay. So you have time enough that the knee is okay?
I know, yes.
And then you send us a video and we say, oh God, 3 surgeries. And she starts again.
Dr. Senior said I can't snow ski this season. So I've accepted that.
No, you have to be carefully a little bit. You need really 3 months that the bone is connecting with the metal. And this is very important because the problem is not the implant. The implant is solid. So
the cement
they always say you are losing the implant, but the problem is not this. This is a bone. The bone goes away if it's getting too much pressure in the beginning.
Oh, okay.
And so we need the connection between the bone and the prosthesis. And then the bone, the prosthesis is pulling on the bone, and pulling on bone makes the bone stronger. And that's the cause why we wait 3 months.
Okay.
If you have the connection, you can go back to sports, of course, carefully, but this works very well. Then.
Okay, that's
good.
This
is very important.
So that's why the 20 kilogram weight limit.
Yeah. in the moment we have to look that the bone is growing on the metal. This is very important.
Okay.
Yeah. But you have to move a little bit because you need the micro movements that the bone is going in connection to the material, but no load on it.
Right.
This is very important.
Okay. Good. No, winter's coming. I'll be good. Let's just be walking.
And when you did your wakeboarding, yeah? Wakeboarding.
Mm-hmm.
What was your thoughts by this? Because you know our discussion after the surgery and before the surgery.
I felt really good. My back felt 100%. And I just know the sport really well, that it's never a big fall. It's not a hard fall.
Yeah, okay.
Because you're going so slow. So that's why I think Charles sent you the video. Although I'm sure Charles was standing behind me saying, "No, don't let her."
No. Do you were happy about the life quality that you can save it now for the next time by the surgeries?
Absolutely, absolutely, yeah.
Okay.
It was totally worth it to wait.
And if the knee is okay, you will start to your world trip?
Yeah, well, I'll have to find out when my husband's ready. My sister and I might do a little bit of traveling in November. So
okay, so
we'll see.
Okay.
Down to the Caribbean. You guys have your Mediterranean, we have the Caribbean.
Yeah, that's right.
Yeah.
Okay. Yeah. So when you think back about all the fears and ups and the problems with the illnesses and with the doctors and the discussions, do you think that this year was a good year or a bad year for you?
Oh, it's an excellent year.
Excellent.
The best year. Best year ever.
Okay.
You know, my friends are all complaining, "Oh man, I feel old." And I'm going, I feel 10 years younger.
What did your daughter said when you came home?
Oh, they were really happy. They were just worried. You know, my oldest daughter was always telling my granddaughter, "Careful, Mom. You know, careful. You know, don't climb on Grandma." And so she's kind of nagged that way. But yeah, and my youngest daughter, I haven't seen her yet. So yeah, we'll see her next weekend. But she's very happy.
You had big party now next weekend.
Yeah.
Okay.
Yeah.
Then you can celebrate a lot of anniversaries, I heard.
Yeah, our anniversary and 2 birthdays.
2 birthdays.
Yeah.
And 3 surgeries.
Yeah, 3 surgeries. That's right. No, it's a great year because I just, you know, it's been a long time since I haven't had any pain.
Yeah.
So.
That you told me before the surgery. You're tired to have the pain, yeah.
Yeah.
Okay.
And you know, you have your golden years ahead of you, and you want to do a lot of stuff and explore a lot of stuff. We were in Scotland last year, and I was in so much pain I just couldn't do much walking. And Scotland's the kind of country that you need to walk to see it. So I think that was the big catalyst for me to do this, was that, man,
okay,
how do you do this? So.
Okay, we did a big work this year with you. I have to thank you because you had a lot of patience. I can remember when I was in the visit in your room, I said always, please be patient, be patient. It will getting better, it will getting better.
Oh, yes.
But you were really tough. And I can remember the first video you sent us when you were home, where you said, "Look here, how I'm walking." And then I saw you yesterday walking, and now you have a knee surgery behind you here.
Yeah.
So it's really nice to see that you feel the good.
Yeah, absolutely. And I knew the walking would come, you know. I believed you. Just everything needed to settle down.
But be careful a little bit, yeah?
You
promise?
I promise.
Okay. I thank you very much that you were here. Thanks. Have a nice evening. Sleep well.
I will.
And then we see us tomorrow morning.
Okay.
I want to say goodbye.
Yeah, we'll say goodbye tomorrow.
Okay. Set you up.
Thank you so much for everything.
Bye-bye.